Every day, millions of people over 60 reach into their medicine cabinets for quick relief from aches and pains. But what if that trusted pill you've been taking for years is silently threatening your heart? Recent medical research has uncovered concerning truths about one of the world's most common painkillers, and the findings are causing healthcare professionals worldwide to issue warnings. This isn't about rare side effects or isolated cases. We're talking about a widespread concern that could be affecting you or someone you love right now. The painkiller in question sits in nearly every household, available without prescription, trusted by generations. It's ibuprofen, part of a drug class known as NSAIDs, or non-steroidal anti-inflammatory drugs. But growing evidence suggests that after age 60, this medication requires far more caution than most people realize. The cardiovascular risks increase significantly in older adults, and many people taking these pills daily have no idea they're putting extra strain on their hearts. What you're about to discover could fundamentally change how you manage pain and protect your heart health.
Ibuprofen and similar NSAIDs have been linked to increased risks of heart attack, stroke, and heart failure. The FDA has strengthened its warnings about NSAIDs increasing heart attack and stroke risk, noting that these dangers can begin within the first weeks of use and increase with higher doses and longer duration. This isn't theoretical concern, but documented medical reality, backed by extensive research. A large study examining over 8 million patient records with an average age of 77 found that people who had used NSAIDs in the previous 2 weeks had a 19% higher risk of hospital admission for heart failure. The study revealed that taking higher doses of these drugs significantly increased the risk, with the danger varying among different NSAIDs in this class. The Precision trial, one of the largest studies examining NSAID safety, compared celecoxib with ibuprofen and naproxen in patients with arthritis. This landmark research provided crucial data about cardiovascular outcomes across different NSAIDs. Research on patients recently hospitalized for serious coronary heart disease showed that short-term use of ibuprofen increased serious coronary heart disease risk significantly compared to non-users. The mechanism behind this danger involves NSAIDs causing the kidneys to retain more salt and water in the body, which increases heart failure risk. These medications can also make blood pressure-lowering medicines like ACE inhibitors and diuretics less effective, and a rise in blood pressure is likely to worsen heart failure. NSAIDs inhibit the COX enzyme that facilitates synthesis of prostaglandins, which are mediators of inflammation, thrombosis, body salt and water balance, blood pressure, and gastric protection. Studies suggest that high-dose ibuprofen at 2,400 milligrams daily showed increased cardiovascular risk, while lower doses of 1,200 milligrams daily or less appeared to have minimal increased risk. This dose-dependent relationship means casual users face different risks than those taking maximum daily doses chronically. Before we continue with this vital health information, if you're joining us for the first time, welcome to our community focused on evidence-based health knowledge. We're dedicated to bringing you research-backed information that empowers better health decisions. Please subscribe and turn on notifications so you never miss important content like this. If you're finding this information valuable, hit that like button to help us reach more people who need to hear this message. And we'd love to know where you're watching from. Drop your country in the comments below.
Unlike acetaminophen, NSAIDs put older adults at risk of internal bleeding and have impacts on kidney function and cardiovascular health. The aging cardiovascular system undergoes profound changes that make it more vulnerable to medication effects. Blood vessels naturally lose elasticity, heart muscle characteristics change, and the body's ability to regulate blood pressure diminishes with advancing age. Studies of older adults show that chronic NSAID use increases the risk of peptic ulcer disease, acute renal failure, and stroke or myocardial infarction. Chronic NSAID use can exacerbate chronic diseases, including heart failure and hypertension, and can interact with numerous drugs such as warfarin and corticosteroids. These interactions create compound risks that younger bodies may tolerate, but aging systems cannot. One clinical trial showed that ibuprofen significantly blunted the effects of antihypertensive drugs, increasing systolic blood pressure by significant margins. For older adults managing high blood pressure, this interference can undermine their entire cardiovascular treatment plan. A study of community-dwelling elderly individuals taking antihypertensive therapy and NSAIDs had blood pressures approximately 5 millimeters of mercury higher than those not taking NSAIDs. The kidney concerns are equally serious. Older adults have reduced kidney function naturally, and NSAIDs further stress these vital organs. Since kidneys regulate blood pressure and fluid balance, their impairment creates additional cardiovascular stress. Many older adults already take multiple medications daily, and each additional drug increases the complexity and potential for dangerous interactions. Among elderly patients, many have high or very high cardiovascular risk profiles, making NSAID selection critically important. The combination of age-related cardiovascular changes, multiple medications, and existing health conditions creates a perfect storm where ibuprofen's effects become magnified and potentially dangerous.
An analysis comparing prior research estimated that 7 to 8 extra cardiovascular events, such as heart attack, would occur each year among 1,000 people taking diclofenac, celecoxib, or ibuprofen. For those taking naproxen, no increased risk was observed in this analysis. While this represents a relatively small added risk, for individuals with existing heart disease or multiple risk factors, these numbers become personally significant. The risk of heart disease associated with NSAIDs is highest in people who already have a heart condition, but it can be a concern in those who don't have heart problems too. The FDA ruled that all NSAIDs must carry a warning label detailing their potential to increase heart attack and stroke risk, strengthening these warnings in 2015. The warnings indicate that risk may arise within a few weeks of taking the drug, and increases for people with and without existing heart disease. It's important to note that concerns about these drugs apply mostly to people who take them on a daily basis rather than for an occasional headache. Occasional use for short-term pain presents considerably less risk than chronic daily consumption. NSAIDs become a more significant concern when regularly used to treat chronic conditions such as osteoarthritis or rheumatoid arthritis over long periods. When prescribing NSAIDs, patients' gastrointestinal and cardiovascular risks should be assessed, with naproxen or low-dose ibuprofen preferentially chosen for patients at risk of cardiovascular disease. This individualized approach recognizes that not all NSAIDs carry identical risks, and not all patients face equal danger.
Understanding ibuprofen's risks naturally raises an urgent question: what can people over 60 use for pain management? Acetaminophen represents the safest first-line option for older adults, with minimal impacts on kidney function and cardiovascular risk when taken at recommended doses. The American Heart Association recommends a stepped care approach to medication therapy for people with cardiovascular disease who have musculoskeletal pain, starting with medications that have the lowest reported risk for cardiovascular events. This approach begins with over-the-counter acetaminophen, prescription tramadol or short-term painkillers, then moves to aspirin-like drugs called non-acetylated salicylates if necessary. Studies show that acetaminophen is equally effective to NSAIDs for patients with mild to moderate osteoarthritis pain. Topical NSAIDs represent another safer option. Compared with placebo, topical diclofenac achieved significant pain reduction, and compared with oral NSAIDs, topical formulations had similar pain relief but fewer gastrointestinal side effects. With negligible systemic absorption, topical NSAIDs are expected to have minimal cardiovascular effects versus oral agents.
Topical analgesic creams are available over the counter, and trying several different ones can help identify which provides better relief for a particular person. For moderate to moderately severe osteoarthritis pain, a trial of low-dose opioid or opioid-like agents, such as codeine or tramadol, in combination with acetaminophen is another option, combining two different mechanisms of analgesic action. Physical therapy, exercise programs, weight management, and non-pharmacological approaches also play crucial roles in comprehensive pain management strategies for older adults. It's important to consider the value of non-pharmacological therapeutic measures, such as physiotherapy and physical exercise, as supplements and potential substitutes for analgesic pharmacotherapy. These approaches address pain's root causes while improving overall health rather than simply masking symptoms.
If you're over 60 and currently using ibuprofen regularly, don't panic, but don't ignore this information either. Schedule an appointment with your physician to discuss your pain management strategy comprehensively. There is a need to focus on the balance between risk and benefit before initiating NSAID treatment. This is especially important in persons with established cardiovascular disease in whom alternative pain treatment with lower cardiac risk should always be the first choice. Bring a complete list of all medications, supplements, and over-the-counter drugs you take to your appointment. Clinicians should assess cardiovascular risk before starting any NSAID treatment. Request a cardiovascular risk assessment, including blood pressure, cholesterol levels, and kidney function tests. These baseline measurements help determine which pain management options pose the least risk for your specific situation. If you don't have a history of heart problems, it's fine to take NSAIDs occasionally in the recommended doses for short-term pain relief. The key distinctions are occasional versus chronic use, and low versus high doses. If an NSAID is necessary, it's important to take it exactly as prescribed, at the lowest dose possible for treatment, and for the shortest time needed. If NSAIDs are required after careful risk-benefit assessment, those with the highest COX-1 selectivity, like naproxen or ibuprofen, should be preferred and used in the lowest dosages and for the shortest periods possible. In elderly patients and those with heart failure or hypertension, close monitoring of blood pressure, renal function, body weight, symptoms of fluid retention, and worsening heart failure is recommended during NSAID treatment. Consider consulting a pain management specialist if you deal with chronic pain conditions. These physicians specialize in multimodal approaches that combine various treatments to maximize pain relief while minimizing medication dependence and associated risks. The evidence is clear. Ibuprofen and similar NSAIDs require careful consideration in adults over 60, particularly those with existing cardiovascular conditions or risk factors. This isn't about creating fear, but about empowering you with knowledge to make informed decisions protecting your heart health. The casual attitude many people have toward over-the-counter painkillers needs reassessment, especially as we age and our bodies become more vulnerable to medication effects. Take action today. Review your medicine cabinet and identify all NSAIDs you're using. Schedule that important conversation with your doctor about safer pain management alternatives tailored to your specific health profile. Explore options like acetaminophen, topical preparations, physical therapy, and lifestyle modifications that address pain without compromising cardiovascular health. Your heart has served you faithfully for over 60 years. Protecting it from unnecessary medication risks is essential. Share this information with family members and friends over 60 who regularly manage pain with medications. You might spark a crucial conversation that leads them to reassess their approach and consult their healthcare provider. If this video provided valuable, potentially life-changing information, please type yes in the comments below. Your feedback motivates us to continue creating content that makes real differences in people's lives. Hit that like button if you found this helpful. It helps us reach more people who need this message. Subscribe and turn on notifications so you never miss our videos on health, wellness, and informed medical decision-making. Share this video with anyone who could benefit from understanding these important cardiovascular risks. Thank you for investing time in learning about this critical health issue. Your health is your most valuable asset. Protect it with knowledge and wise choices. Until next time, stay informed, stay healthy, and take excellent care of your heart.